Your heart deserves protection, especially as the years go by. But here's something most doctors won't openly discuss with you. The real threat to your cardiovascular health might not be coming from your lifestyle choices or family history. It could be hiding in plain sight, right inside your own medicine cabinet. Right now, millions of seniors are taking medications every single day. Pills that are perfectly legal, FDA approved, and prescribed by trusted physicians. Yet these same medications can quietly elevate your risk of cardiac complications, stroke, and even heart failure in aging bodies. The alarming part? Most older adults never receive adequate warnings about these risks. Prescriptions get automatically refilled month after month. Concerning symptoms get dismissed as normal aging. Dangerous drug interactions slip through the cracks because nobody's looking at the complete picture. But today, that changes for you. We're revealing 5 categories of medications that pose significant risks to heart health in adults over 60. Some of these will sound familiar. Others might genuinely surprise you. But every single one deserves your careful attention and a thorough conversation with your healthcare provider. This isn't about creating panic or fear. This is about empowering you with evidence-based information, supported by medical research, and explained in language everyone can understand. Whether you're over 60 yourself or you care deeply about someone who is, the insights you're about to discover could genuinely protect cardiovascular health, maintain independence, and potentially save lives. Before we begin, please remember to like this video and subscribe to our channel. Hit that notification bell so you never miss critical health information that could change your life. Now, let's dive into number 5. Medication number 5. NSAIDs. The hidden cardiovascular strain of common pain relievers. Number 5 on our list. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. We're talking about ibuprofen, naproxen, and diclofenac, medications found in virtually every household across the country. These pain relievers are incredibly common, readily available without prescription, and most people consider them completely safe. When arthritis flares up, when back pain strikes, when a persistent headache won't go away, reaching for an NSAID seems like the most natural thing in the world. But here's what changes after age 60. These familiar pills can transform into serious cardiovascular risks. How NSAIDs affect your aging body. NSAIDs don't just block pain signals. They fundamentally alter how your kidneys handle sodium and fluid balance. In younger individuals, the body typically compensates without major issues. But as we age, kidney function naturally decreases, even when standard lab tests appear completely normal. This gradual decline means your body may start retaining excess fluid. You might notice your ankles swelling by evening. Your shoes might feel tighter than usual. You could experience a heavy sensation in your legs or unusual fatigue by day's end. Most people write these symptoms off as inevitable aging, but they're actually warning signals your body is sending. The cardiovascular consequences. Fluid retention directly increases the workload your heart must handle. For older adults, especially those managing high blood pressure or who have any history of heart disease, this additional burden can trigger worsening heart failure or cause dangerous blood pressure fluctuations. The risks extend even further. NSAIDs can reduce blood flow to your kidneys, progressively weakening their function over time. Medical research has connected these medications to elevated blood pressure, kidney damage, and increased heart attack and stroke risk. The longer you take them, the more these dangers accumulate. Even short-term NSAID use carries risk, particularly when combined with other common medications like diuretics or ACE inhibitors. This creates what doctors call a triple whammy, a dangerous combination that can severely compromise kidney function and dramatically increase cardiac strain. Why? This is so dangerous. The insidious nature of NSAID risks lies in their subtlety. You won't feel your kidneys struggling. You can't sense your heart working harder. The symptoms are quiet, mild swelling, increased fatigue, occasional dizziness, all easy to dismiss as just getting older. Because NSAIDs are available over the counter, they don't feel serious. That's precisely what makes them so risky. People take them daily without thinking twice, never realizing the cumulative impact on their cardiovascular system. What you should do: if you're taking NSAIDs regularly and you're over 60, schedule a conversation with your doctor about whether they remain your best option. You might not need to eliminate them entirely, but switching from daily use to occasional use can significantly reduce risks. Safer alternatives exist depending on your specific pain needs. Acetaminophen works well for certain types of discomfort without affecting the heart or kidneys. Topical pain treatments deliver relief directly where you need it without systemic effects. Lifestyle modifications like regular stretching, heat therapy, or working with a physical therapist can effectively manage chronic pain. The goal isn't suffering without relief. It's managing pain intelligently without creating bigger cardiovascular problems down the road. For older adults, NSAIDs might seem harmless, but they could be silently threatening your heart health. Medication number 4. Benzodiazepines. The sleep aid that steals your stability. Number 4. Benzodiazepines. Medications prescribed for sleep difficulties and anxiety management. If you've struggled with falling asleep, staying asleep through the night, or managing anxious thoughts, your doctor may have prescribed lorazepam, diazepam, or temazepam. These drugs belong to a medication class called benzodiazepines, and for many older adults, they feel like essential lifelines. A pill that helps you sleep through the night, a pill that takes the edge off anxiety, a pill that simply helps you feel normal again. But what if that same medication was simultaneously increasing your fall risk, creating confusion, and potentially contributing to long-term cognitive decline? How benzodiazepines work, and why that's problematic. Benzodiazepines function by slowing neural activity in your brain and nervous system. That's exactly why they help you feel calm, sleepy, or less anxious. But in older adults, this effect can become excessive and dangerous. These medications don't just relax your mind, they also slow reaction times, impair muscle control, and compromise balance. This combination dramatically increases fall risk, especially during nighttime hours, when grogginess peaks and lighting is poor. Falls aren't minor accidents at this stage of life. They represent one of the leading causes of injury, hospitalization, and loss of independence among seniors. A single fall can trigger a cascade of health problems that fundamentally alter quality of life. The deeper cognitive dangers. Beyond fall risks, benzodiazepines are linked to memory problems, mental fog, and even elevated dementia risk with long-term use. What begins as mild forgetfulness or difficulty concentrating can gradually worsen, and most people never connect it back to their sleep medication. Then there's the issue of physical dependence. Your body adapts to benzodiazepines over time. You may need higher doses to achieve the same effect. Stopping suddenly can trigger withdrawal symptoms, including severe anxiety, insomnia, restlessness, and even tremors. It becomes a vicious cycle. You need the pill to sleep, but the pill may be slowly eroding the mental clarity and physical stability that quality sleep is supposed to support. What you should do. First and foremost, don't panic and never stop benzodiazepines suddenly. That can be genuinely dangerous. If you're currently taking these medications, have an honest conversation with your doctor. They may recommend a slow, medically supervised tapering schedule or explore safer alternatives. Effective non-drug therapies exist. Cognitive behavioral therapy for insomnia, CBTI, is one of the most effective treatments for chronic sleep problems, and it comes with zero side effects. For anxiety, approaches like mindfulness practice, breathing exercises, regular light exercise, or certain antidepressants can provide relief without the same risks to balance or memory. The key understanding is this: not every sleep problem requires a sedative. And for older adults, what appears to be a small dose of relief can carry an enormous cost. That little pill helping you drift off might simultaneously be pulling away your balance, your awareness, and your independence. Medication number 3. Proton pump inhibitors. the silent drain on your body's resources. Number 3, proton pump inhibitors, or PPIs, medications taken by millions of seniors for heartburn and acid reflux. Heartburn, acid reflux, indigestion, these digestive complaints become increasingly common as we age. For many people, relief comes in the form of a small pill, omeprazole, pantoprazole, or esomeprazole, medications known as proton pump inhibitors. PPIs work by dramatically reducing stomach acid production. For short-term relief of acute symptoms, they can feel miraculous. No more burning sensation in your chest. No more sour taste in your mouth. No more discomfort after eating. Just one daily pill, and the discomfort vanishes. The problem. Nobody discusses. Here's the critical part most people never hear. These medications were never designed for long-term use, especially not in older adults. Yet millions of seniors take PPIs every single day for months or years without ever reassessing whether they still need them. Over time, this seemingly harmless routine can lead to serious consequences, some directly affecting your heart, your bones, and your overall physical strength. How PPIs deplete essential nutrients. One of the most overlooked effects of PPIs involves nutrient absorption interference. Stomach acid isn't just there to cause problems. It plays a crucial role in helping your body absorb essential minerals, including calcium, magnesium, and iron. When acid levels remain too low for too long, these vital nutrients don't get absorbed properly. Low calcium means weaker, more fragile bones. In older adults, this translates to significantly higher fracture risk, especially hip fractures that can be life-altering events. The problems extend beyond bones. Magnesium deficiency, which becomes more common in long-term PPI users, can affect heart rhythm regulation, cause persistent muscle cramps, and lead to dizziness and fatigue. Low iron and vitamin B12 can cause anemia, nerve problems, and mental fog, all issues that resemble natural aging but may actually be medication-related. Additional risks beyond nutrients. Stomach acid also protects you from harmful bacteria. When it remains too low for extended periods, your body becomes more vulnerable to infections, particularly Clostridioides difficile, a gut infection causing severe diarrhea and dehydration, especially dangerous for older adults. Emerging research has linked long-term PPI use to higher risks of kidney disease, dementia, and cardiovascular problems, though scientists are still investigating these connections. But the pattern is becoming clear. The longer you take these medications without medical review, the more the risks begin outweighing the benefits. PPIs aren't bad, they're just overused. To be clear, PPIs are effective medications, and in many cases, they're medically necessary, especially during active ulcers, esophagitis, or certain stomach conditions. The problem is that what should be a temporary treatment often becomes a permanent habit nobody ever questions. If you've been taking a PPI for more than a few months, it's worth having a conversation with your doctor. You may still need it, or you may not. Some people can successfully switch to lower doses, take medication only when symptoms flare, or gradually taper off entirely under medical supervision. Because sometimes relief today shouldn't come at the cost of your strength, balance, and resilience tomorrow. Medication number 2, cardiovascular medications. When the cure becomes the risk. Number 2, heart and blood pressure medications. When protective treatments become dangerous. When we think about medications that damage the heart, blood pressure pills don't typically come to mind. After all, they're supposed to protect your cardiovascular system, lowering pressure, reducing strain, helping your heart work more efficiently. For millions of older adults, these medications are absolutely essential. But here's an uncomfortable truth. The same medications prescribed to protect your heart can also endanger it, especially if doses are too strong. Combinations are too complex, or your body has changed significantly since the prescription was originally written. Diuretics, the water pill problem. Let's start with diuretics, commonly called water pills. These medications help your body eliminate excess fluid and sodium. They're routinely prescribed for high blood pressure and heart failure management. But in older adults, diuretics can lead to dehydration, dangerously low potassium levels, sodium imbalances, and persistent dizziness. That tired, lightheaded feeling when you stand up? It might not be aging. It could be your water pill pulling too much fluid from your system. Calcium channel blockers and beta blockers. Calcium channel blockers relax blood vessels to reduce pressure. But in some seniors, they cause significant leg and ankle swelling, excessively slow heart rates, or led to fatigue and mental fog. Beta blockers, another common cardiac medication class, can be equally tricky. They slow heart rate, which is therapeutically beneficial, but sometimes excessively. This can cause shortness of breath, cold hands and feet, and reduced exercise capacity. In people with diabetes, beta blockers can even mask warning signs of low blood sugar, creating hidden dangers. The aging body changes everything. Here's the fundamental issue. The human body changes dramatically with age. Blood vessels become stiffer. Kidneys filter more slowly. The way your body processes salt, water, and blood pressure fundamentally shifts. This means a medication dose that worked perfectly well at age 55 might be far too strong at age 75. And it's not just about one pill. Many older adults are prescribed multiple heart medications simultaneously. A beta blocker, a diuretic, something for heart rhythm, something for cholesterol. And the combination can quietly overwhelm the system. The polypharmacy problem. This is called polypharmacy, and it's incredibly common among seniors. One medication leads to another to manage side effects, and before long, the body is juggling 6 or 7 prescriptions simultaneously. You start feeling off, foggy, weak, less steady on your feet. You might assume it's age, but in many cases, it's medication overload. When heart medications begin interfering with balance, kidney function, or energy levels, hospitalization risk actually increases, not because of the heart condition itself, but because of how it's being treated. The solution: regular medication reviews. To be absolutely clear, these medications can be life-saving, but they need regular reevaluation, not just automatic refills out of habit. The goal isn't just controlling numbers on a medical chart. The real goal is keeping you sharp, steady, mobile, and independent. If you or someone you love is over 60 and taking multiple medications for blood pressure or heart disease, ask these critical questions. Are the doses still appropriate? Are these medications working together harmoniously, or are they working against each other? Because the right heart medication can save your life, but the wrong combination can quietly steal it away, piece by piece. Medication number 1, polypharmacy, the most dangerous pill is all of them. Number 1, polypharmacy, when the real danger is the combination. If there's one pill that poses the greatest risk to older adults, it's not a single medication at all. It's the combination. Polypharmacy, the medical term for taking 5 or more medications simultaneously, has become one of the most dangerous and consistently overlooked threats to senior health. And it's shockingly common. The scope of the problem. Research studies show that nearly half of all adults over 65 take 5 or more medications every single day. Many take considerably more. A pill for blood pressure, another for cholesterol management, something for sleep, something for pain relief, an acid reducer, a daily vitamin, a mood stabilizer. One pill leads to another, and then another, until your body is juggling a complex mixture of drugs that were never tested together, especially not in aging physiological systems. Why? This is so dangerous. Here's what most people never understand. Every new medication increases the probability of side effects. Every combination raises the risk of harmful drug interactions. Every additional pill makes it harder for your kidneys, liver, and heart to keep functioning optimally. The effects aren't always dramatic or obvious. They're subtle and gradual. You feel more tired than usual. You're less steady on your feet. You start forgetting things more frequently. Your digestion slows down. Your mood shifts unexpectedly. Most people naturally assume these changes are just part of aging. but sometimes they're not. Sometimes it's the medications. The prescription cascade. The most troubling aspect? Many of those prescriptions are no longer medically necessary. They were prescribed months or even years ago and never reassessed. Sometimes the original condition has resolved or changed. Sometimes the side effect of one drug is being treated with yet another drug. It creates what doctors call a prescription cascade. Not a path toward better health, but a quiet spiral into fatigue, frailty, and increased dependence on medical systems. Polypharmacy doesn't just strain your heart. It can steal your mental clarity, your physical energy, and your independence. The solution isn't stopping everything abruptly. That can be dangerous. The solution is reviewing everything systematically. A skilled physician or clinical pharmacist can help you examine your complete medication list, identify outdated prescriptions, eliminate what's unnecessary, and adjust what's still needed. The results of proper medication review can be genuinely life-changing. Less dizziness, more energy, better focus, a clearer mind, fewer falls, fewer hospital visits. And sometimes, simply feeling like yourself again, perhaps for the first time in years. Because optimal health isn't always about adding more interventions. Sometimes it's about letting go of what's no longer serving your well-being. If you or someone you love is currently taking 5 or more medications, don't wait. Schedule a comprehensive medication review. Ask the difficult questions. And don't be afraid to advocate strongly for yourself or your loved ones. Because the most dangerous pill might be the one you didn't realize you were still taking. If you found this information valuable, please give this video a like and subscribe to our channel so you don't miss future content. We break down important health topics like this every single week. In the comments below, I'd love to hear from you. How many medications are you or a loved one currently taking? Have you ever questioned whether all of them are still necessary? Your personal story might help someone else more than you realize. And remember, sharing this video with a friend or family member could be the first crucial step in protecting their health and independence. Thank you for watching, and until next time, take care of your heart. It's the only one you've got.